Good evening and welcome to my YouTube channel Pain Free Partha. And videos you can have from YouTube Pain Free Partha, and slides around 400 are freely downloadable and editable from www.painfreepartha.com. Today's topic is about placebo and greetings from Mahatma Gandhi Medical College, Sri Balaji Vidyapeeth, Pondicherry, India. And a salute to the legendary teacher, Professor Ravi Shankar. Now, the term placebo is coming from the word Latin placere, which means to please. Placebo means to please. In the 18th, the term became part of the medical jargon, and these two people were pioneers of placebo. And there was something called Beecher's theory, an observation in the Second World War, when he injected wounded soldiers with physiological saline solution in the absence of morphine, and he found out good results. But there was no control group, but there were flaws in that report, but still his observations are still valid as Beecher's theory of placebo. What is the definition of placebo? It's a pharmacologically inert preparation, prescribed more for the mental relief of the patient than for its actual effect on a disorder. It is not actually affecting the disease, but there is a relief. This is what is called a placebo. It's a pharmacologically inert. There is one study which tells 40% of the prescriptions functions as a placebo. Sometimes physicians aware of it, and sometimes physicians not aware of it. There are two types of placebo. Pure placebo means there is nothing in it, just maltose, lactose, talc, water, starch, saline, something like that. Impure placebo means there is some substance, there is some vitamin B6, and it is definitely known we are going to treat something like hypertension. B6 and hypertension as wrong indication or a subtherapeutic dose. So this is an impure placebo. Pure placebo is completely inert. Now I will give you two interesting stories, which are true stories. A neurosurgeon was supposed to go ahead with a major operation, which is about 10 hours. And he had some pain in the right iliac fossa. The normal surgeon diagnosed this as appendicitis, and he has to take the appendix operation. But he said, I cannot do that. I have to proceed with neurosurgery operation now. Then the nurse gave him 10 milligrams morphine for the pain relief, and after some time he had good relief, and then started to proceed the neurosurgery case and finished the case. But after that, the nurse's report was stating that the neurosurgeon was so distressed, so I gave only 1 ml of saline instead of morphine. So that was a true story, that he got so much good relief from 1 ml saline, and he operated a neurosurgery case. There's one more placebo. Instead of doing, now we are doing CABG. Previously, ischemic heart disease, coronary block, what they did was they opened and blocked the lima outside arteries in the hope that the inside blood flow will be more. But after some years, they were doing this operation and there were ECG changes and good clinical changes. But after some years, one pathologist, all the postmortem biopsies of these patients who had underwent this so-called placebo operation of clamping the outer vessels in to think that the inner vessels will be better supplied. They found out there is no new vessels. All vessels are blocked only. So he said this is the biggest placebo. What are the mechanisms of placebo effect? You see the rostral anterior cingulate cortex that project to the pons and goes to the cerebellum. So this is the corticopontocerebellar circuitry, Purkinje fibers in the cerebellum, and mainly involving the endorphins. So RAC, PN, cerebellum, endorphins. This is the basic neural circuit behind placebo effect. There is something called embodiment theory. According to this theory, our experiences are not only stored in our memory consciously, but also unconsciously, some non-conscious process by a previous experience. So sensory motor stimulus generated in the previous. So such embodiment can have positive or negative effects. I will tell about what is nocebo later. Now, see, the pain severity is coming down even without treatment. And with the placebo, much. With the drug ibuprofen or something, very good. So, what they call sometimes the placebo and the no treatment as placebo effect, and the placebo and the drug this as placebo response. This is placebo effect and this is placebo response. Sometimes these two words are confusingly used. What are the factors in placebo? Now you see verbal suggestions. Oh, this drug is going to be used. I'm going to give this drug which has been used for so many years, and this is a fantastic drug to kill pain and all. So you suggest the patient verbally. Learning and memory, similar example. It worked well before. Context factors means how friendly the doctor is to you. Doctor is a good friend. Sometimes I know one doctor here, even if he gives a diarrheal drug for diarrhea, it cures. Personality, how optimized? There are some genes. How is the personality? Negative, positive. So many things, genes. So many things are factors in placebo. Now, this is the pain intensity. This is the remifentanil infusion. Now, the baseline pain is there. We have started the remifentanil. Now, we have not put any positive expectation. This remifentanil is fantastic. Something like that we are not told. Then the pain intensity comes from 65 to 50. If we have positive expectations, it comes to 40. And if we have negative, it doesn't from possibly 70 to 65. Negative means what? We are giving one infusion, sir, but it may not be that effective. It cannot be proven to be very effective. Even the same remifentanil infusion with a negative expectation, you see here, there is not much of pain relief. So already we have told there is a component of endorphins. So prior naloxone may decrease placebo effect. Placebo-induced analgesia condition with NSAIDs is not affected by naloxone. There is another problem. Sometimes rimonabinol, a cannabinoid receptor, can block this effect. Now, what is engineered placebo analgesia? You use the optogenetics to activate. Optogenetics is basically light, using light, and change the brain area, and especially central amygdala, so that there is a pain relief. This is what is called engineered placebo analgesia. So there is, see, for example, if you take diazepam or if you take morphine, there is a pharmacokinetics. It gets absorbed, it gets different into form. This thing, it acts, starts to act by 10 minutes and it finishes by 8 hours or something like that. Though the same thing is there for placebos also. They may have a latent time. They may act complete an app action for 4 hours, something like that. They may have tolerance. They may have addiction. Everything will be there in placebo also. Most important thing is it is effective only on symptomatology. Now you have pain, if you take placebo, it will decrease. Will it cure the trauma? Will it cure the fracture? No. It is not curative, and it is of short duration. It may persist for some time after a discontinuation, but a short duration, symptom relief, no curative power. That is what is the characteristic of a placebo effect. Factors. What are the factors associated with occurrence? Now, the appearance should be good. Size, flavor, genetic, everything should be good. Number one. Number two, there are placebo responders and non-responders. There may be age, gender, culture, ethnic level placebo non-responders. Patients to be positive, by whom and where it is carried out. Prior conditioning. All these things are some of the factors. Factor three is the doctor-patient relationships. That is what I told first slide, 4 pictures. First you give morphine, the second you give placebo. It works. What is virtual reality? Virtual reality is a technology that creates a computer-generated environment where you can interact if you are really there. Now you have a goggles, special goggles, and you can control it. You can play games, practice skills, and you can also wear a goggle, and this actually tells us the actual video of you going to the preoperative room, getting pre-medication, going into the operation table, getting into the lateral position, and giving spinal. Completely, you can have the day before. Virtual reality can be there. So this is what is called virtual reality. Now you have got a skin graft surgery done. It's very painful. Then you have a VR skin, virtual reality in a calm, serene beach atmosphere. So when engaged in this immersive experience, their focus shifts towards the calm, serene beach scene, and it decreases anxiety and decreases pain. Real bodies not required placebo analgesia and pain perception in immersive, virtual, and augmented realities. Standard-based therapy, VR-based basic research. So much is there to get that symptom release. Augmented reality, virtual reality, and mixed reality. Augmented reality enhances the real world with the digital information, while virtual reality creates a complete immersive simulated environment. AR adds to our existing surroundings, okay? Whereas separate, VR means separate, completely, it is there, completely. Augmented reality means there is some audio. We are having the real world, and it augments that. Virtual, augmented, and mixed reality can also be there for the technology of chronic pain also. Not only acute pain, it also for chronic pain, placebo. Now, why we are bothered about placebo? We need to do randomized control trial of anything. We always do, no? Bupivacaine versus saline. Because saline itself will give 10% relief. And bupivacaine at least should be 30% relief. Otherwise, it's a waste. Okay, no? So the intervention should be significantly more than the placebo effect. That is why we need placebo as saline or distilled water or whatever it is. This is what is called open label placebo, non-deceptive. The patient is not deceived. He knows that he takes the placebo. There also it is effective. That is what is called open label placebo. There are some ethical concerns with this, but people has to be clearly consenting for this open label placebo. Placebo itself, see, for example, a post-operative pain is slowly decreasing. And if you give placebo, it will decrease. Slowly it is regressing to the mean. So we cannot say the placebo is effective. Sometimes you give a placebo, along with it, you do some psychological treatment, some music therapy is going on in the post-operative ward. So additional treatment. Response bias. The patients will give wrong response. Reporting bias. The investigator may give a bias that this placebo is wonderfully acting. Hawthorne effect is what is that? No, it's an interesting effect. Suppose a patient, I am the patient, I know that I am the study, I am in the research work. I will tell, oh, this drug is super and all. We know that we are in the clinical trial. Then we tell that this drug is useful and tell the pain has to be 2 or 3. This is what is called Hawthorne effect. Then we know something about placebo when we go to nocebo. Nocebo means nausea, meaning to harm, damage, adverse effects of placebo. So we don't see that adverse effects. Sometimes, many times we see, nausea, vomiting with morphine is 20%, while that of a placebo is 8%. Okay, so we don't see these adverse effects. It usually there are studies in which after a tooth extraction, placebo has increased pain, hyperalgesia. The most common symptoms of nausea, dry mouth, drowsiness, anxiety, headache, dizziness, so much things, feeling of heaviness, they may vary up to 10 to 19%. So this may have a negative influence. So this is the problems and this is the plus. Now you have a contextual factors. Okay, there are contextual factors, the relationships, clinician characteristics, healthcare settings, patient characteristics. What is the treatment we are giving? All these makes the expectations to work with rock, PN, cerebellum, and there are other PAG and RVM, rostrometalbutyres. The placebo will work as opioids, endocannabinoids, dopamine, oxytocin, vasopressin. Sometimes the nocebo will work with dopamine and opioid deactivations. So the history we know, features, effect, and I told two original true stories. Definition is administration of a pharmacologically inert substance to produce a good, positive, beneficial response. There are so many factors. I have told social, doctor-patient relationships, how much the patient is positively affected. I have told about remifentanil infusion being decreased in effectiveness because you have put a negative influence. The neural chemistry is all about, right, PN and pontinucleus and cerebellum Purkinje fibers. Why not it clicks? I told the pain itself will decrease. There are some negative influences. There is some additional treatment. Virtual reality is about a beach scene when there is a pain. Nocebo is a harmful effect of a placebo. Thank you all. Visit me at pain